I am Amita, co-founder of Nourish Talk, an outcome-based platform for natural and holistic therapies. In our educational session today, we are going to talk about spine wellness through Ayurvedic therapy. Presenting this topic, we have Dr. Ranjan Tewari, who is MD in Ayurveda. He has specialized in Panchakarma, Shar Sutra, Marma therapy, and Agni Karma, a procedure that's used for pain management. And he will be presenting this topic today. Welcome, Dr. Tewari.
Hello, Amita ji. Hello, everyone in India and USA. I am Vaidya P. Tewari from Uttarakhand, India. And today I'll be presenting my views on the spine disorders and their management through Ayurveda.
Great. So this is an interactive Q&A session. So we are going to start with Dr. Tewari. If you could start with the overall agenda that you're going to talk about, as well as overview of spine health, as a lot of people suffer from it in today's day and age.
Yes, see, when we talk of spine, before coming into the topic, first let me give you an overview agenda of and the fundamentals of Ayurveda that we focus on while treating the spine disorders. So Ayurveda basically believes in two things. The two parameters are, first is of the swasthasya swastrakshanam, that is the maintaining the well-being of a healthy individual. And secondly, it is all about treating the disease, that is aturasya vikar prashanam, which is treating the disorders or any disease present in a human body. So the first point is very important, which is maintaining the healthy state of a person. And this is what we also deal in spine disorders. That first of all, we need to educate all the patients and all the general, public, how they can keep their spine healthy. That involves the exercise, the diet, the posture alignments while working. So that is one part. The other part is when they get spine disorders like disc slip, protrusion, extrusion, or even canal stenosis, can be very well managed with Ayurveda. And we have different ancient Ayurvedic as well as the most modern techniques that we have involved. And we not only believe in treating, but we also believe in healing. So the most modernized therapies in Ayurveda like Marma therapy and the Bandhana Karma and involving the kinesiology taping. So we help in rehabilitation, and proper education of patient results in the cutting the disease from the root and maintaining his or her health for a very longer period of time. So talking about the spine wellness, so first is the health, the healthy spine. And since the Ayurveda believes in three fundamental doshas, which are the Vata, Pitta, and the Kapha. So Vata is moreover involved in the pain or momentary dysfunction. Pitta is more of the tenderness and swelling, and Kapha is more involved in the stiffness and along with swelling and pain. So we will take all these three one by one and then we will discuss. But before moving into the topic, I would like to tell you that all our body, each and every cell contains all these three doshas, Vata, Pitta, Kapha. And it is very important to understand the three dosha. These three dosha are known as tridosha. And then only we can understand the way we use medicines and the Ayurvedic therapies. So Vata, Pitta, Kapha is present from a normal biological cell to the full structure of the bodies. You can say in a plain biological cell, we have the mitochondria that plays the role of a Pitta, the protoplasm plays the role of a Kapha as it is the fluid content, and the nucleus, which is the basic functioning body, it plays the role of Vata. So that is how we, manage the Vata, Pitta, and Kapha, the Tridosha factor, while treating the spine disease. So this was an overall view, which we will take forward into our next slide. So over to you, Amita.
Yes, so can you talk about the different misalignments, right? And when we talk about the spine health, so what are the different misalignments that happen to anyone's spine?
Yeah, talking on the spine disease, since I have been working on this for the past 7 years, exclusively on disc disorders. So the most common causes that I found and that was very much listed in the text are improper weightlifting, that usually, guys in the gym, you will see they have the deficiency of vitamin D3 and calcium, and then they start lifting heavy weights. So that is a basic cause of this misalignment. From the common factors that we have in our home, lifting the beds and other the things here and there. Sometimes each and every individual experiences back pain or a neck pain. So that is one cause. Long traveling, that is another cause, and long-term sitting, so in a improper posture. So that these are some basic factors that are involved in the disc misalignments. And the most common misalignments that we face are the disc bulge, which is just the outhousing of a disc, but disc bulge and the disc slip are almost the same, but it has not teared the annulus fibrosis of the disc. When we come to disc protrusion, it is somewhat more furthering displacement of the disc, but in this case also still it is inside the annulus. Next comes the disc extrusion. Now this is a condition where patient can be symptomless, or he or she can be bedridden. So this is something where the Ayurveda has a big role to play, because patient with disc extrusion will be certainly advise surgery for the disc, and then they seek the holistic approach and all the natural approach. So this is where our role is magnified. And the next is canal stenosis. So this can be due to external trauma or an accident or an injury, the road accidents that we commonly see. So the anterior posterior diameter of the disc space is reduced, and it brings the symptoms like pain, numbness, paresthesia, and swelling around the displaced area, and the stiffness, unable to walk, improper gait. So these are the different kinds of misalignment with their symptoms.
I don't think a lot of people know about that Ayurveda can be so beneficial, especially for disc protrusion that you pointed out, because I know my friend had the problem, and the first thing they wanted to do was surgery, and nobody thought of anything else. So this is a very informational session for a lot of
and as an Ayurvedic practitioner, I like to tell you, I get to see around 8 to 10 disc protrusion, extrusion, and disc displacement cases daily, and we very well manage it with Ayurvedic therapies, not involving any kind of allopathic or any else treatment, and the patient responds within 14 days. So that is something we have worked upon, and we are just trying to reduce the days. We are just trying to get the patient fit within 5 to 7 days. So it's just a proper approach that we need to take as a practitioners, and everything is possible in Ayurveda.
That's very, very encouraging. So let's talk a little bit more, going into the detail of the Ayurvedic remedies for spine wellness. If you can go in detail.
Yeah, see, when we treat the spine disorders, first we analyze the dosha. So as earlier I have discussed, now I will give you a little more idea of how we go into the, diagnosis of the spine disorders. So the area above the shoulders is mostly described in Ayurvedic tests as the area of kapha, although the vata and pitta will always be present throughout the body, but this is the predominant area of kapha. So every cervical disorders, cervical radiating pain, myelopathies, so they will involve the more of kapha. So first we have to treat kapha, which covers the vata. Vata is a causative factor for pain, and kapha will be the causative factor for heaviness and stiffness around the arm and shoulder and neck area. So first we have to clear out the kapha, and then we have to treat the vata in most of the cases. Similarly, when we come to the shoulder to umbilicus area, it is more over the area of thorax and L1, L2 spine, you can say, and this involves the area of pitta. So here we have to take the consideration of pitta, since the digestive fire is a representation of pitta. So this is the area where we have to treat the pitta also, along with the pain causative factor vata. And the next is below umbilicus, which is the most common area of lumbar disc prolapse, L5, S1, L4 prolapse, sciatica, and avian, and the various sacroiliitis. This type of disease, when we come across, we deal with more prominently with vata, because it is area of vata. So the different therapies, Ayurveda therapies, work well. So talking about the Ayurvedic remedies, how we use in them, though, first comes the internal medicines. So in this panel, we have the various type of gugulus. So gugulus are moreover the pain suppressive factors in Ayurveda, and it also shreds down your fat and helps to bring the new metabolic energy inside your body. So the various medicines are Yograj Gugulu. Yograj Gugulu is the most commonly used, the pain suppressing medicine, and it has been so every medicine that we use, it has to be Vyadhi Visheshatvam, which is the specific disease mentioned in a disorder. And then it has to be Dos Visheshatyam, that the predominancy of dosha. So we will take the medicine, select the medicine according to dosha. And the third is Sthan Visheshatvam. Sthan means the place. So if we are treating the cervical region, we will select the medicine which will rule out the Vata and the Kapha. So that will be more helpful. And the other is Prakarana Visheshatvam, like the Acharyas and the Rishis has mentioned in the text that this medicine has to be given in a certain disorders. So that's how we select. So Yograj Gugul is one of the most commonly medicine we use for pain suppression, and it has for this it has been mentioned in the text that Am Vatadinam, Preminam, Hanu Shulam, Karn Shulam, Hanu Graham, and it is used with the Rasnadi Kwat, very effective. And the Prakran Visheshatvam, the Vishesh Falshruti is Punsavana. Even in fertility case, most of us don't know this, but even in infertility cases, the Punsavanam and the Reto Vriddhi, which is increasing the sperm count of the patient, we use Yograj Gugul. Similarly, the next is Mahayograj Gugul. So Yograj and Mahayograj are a little bit different in their contents. The Mahayograj contains Nagam, Mangai, Yashandam and Yeva Sinduram, and it has a very specific quality of this medicine is it is used with a different decoctions and the oral intake supplements, and that's how it changes its role. See, for the Vata, we will use Rasnadi Kwat for Yograj Gugul. For Pitta, we will use the Kakulyadi Kwat. For the Kapha, we will use it with the Aragvadadi Kashayam. So this is how the Mahayograj, the beauty of Mahayograj Gugul is. Treyodashang, next is the Treyodashang Gugul. It is Branganam Gugul. So whenever you find a lean and thin person coming with the disorders and pain and stiffness around the joint, we select Treyodashang Gugul, or it is also known as the Abha Gugul. So it will potentiate. It is the Branganam Gugul, which means it will develop and boost the health of an individual along with suppressing pain. Panchatikta Gugul is another, when there are Pitta factor, and it is more over related to the Majja, which is the annulus and the disc, we can say. Rasnadi Gugul is another Vata suppression Gugul, and Kashore Gugul, most of the Ayurvedic practitioners know it is a Pitta suppressing Gugul, very much useful in gout and other inflammatory, the signs of this disorder that we do. So these are the basic tablets form preparation that we use. Next, we select different kind of oils. So oil selection has to be very, specific. It's not that we hear everybody saying you use sesame oil, just warm it and rub everywhere. So it's not possible to get the results with, the every oil everywhere. So it has to be selective. So what we find is when we are treating the cervical spondylitis, so the first factor comes is the, Kapha. Kapha has surrounded the Vata. So we have to shred out the Kapha. So for that, we will select the Ushna oil, which are the hot oils, hot in nature. So some oils are Shita and cool in nature. Still, they will help in pain suppression. And some oils are hot in nature. So they will cut the Kapha earlier, and then you can use the other oils. So in this regard, we have Vishmushtadi and Chinchadi. So these are all hot oils. So this you can use in cervical spondylitis. And later on, when you have treated the pain and every condition, then you need Branganam oil, like, Karpasthayadi and Prasarini Tel, Mahamasham, Masham, Mahanarayan. So these are, potentiating and, Branganam oil, Madhur and Sheep. So these are the little bit of oil which we use in day-to-day practice in our Ayurvedic therapies. Next is the very important part, Kashayam. Now, I'm telling so many, medicines, but we don't use every medicine. Since I have mentioned all the specificity of each and every medicine, like the Gugulus and the oil, so now comes the Kashayam. So you don't need to use each and every medicine. You just have to select according to diseases. So first, you can use the Rasna Saptakam for it. It has been mentioned Vatam Kapam, Vatkapharam, Ushnam, Katigraham. So especially for the Katigraham means the sacroiliitis and acute disc prolapse. You can go for the Vata, Rasna Saptak Kashaya, which is Trik Visheshatvam and Kadi Visheshatvam. So this is the Sthan Visheshatvam that I was talking about, like the place where you have to use in the Trik area and the Kati area. So next we can talk about the Sahacharadi Kashaya. So Sahacharadi Kashaya is another very important, Ushna Viryam Kashaya, Vatkapharam, Ushnam, and it is more used in the, lower back pain and disc protrusion and most common disc bulges. So the next we can take the Adari Sahacharadi. Adari Sahacharadi is special in its form that for it has been mentioned that Adokaya Visheshatvam. It is for Sahacharadi and Adari Sahacharadi both, but Adari Sahacharadi is more used in movement dysfunction. When throughout the bodies, the Vata has suppressed the biological functioning and the kinetic mechanism of the body. There we use, Adari Sahacharadi. Then we have the Rasna Shuntyadi. For Rasna Shuntyadi, it has been mentioned Madhushitam and Manyastam Visheshatvam. So in the temporomandibular joint, misalignments, which is very common nowadays and very rare to treat, and people find it a lot of difficult. So Rasna Shuntyadi is one good drug. Along with, we have to do the, TMJ manipulation, and some of the practitioners in India do it. So with TMJ manipulation and Rasna Shuntyadi Kashaya, we can manage it very well. So these are the little bit of Kashayam and Dhanvan. Another beauty of Kashayam, you can see we have the Gugul Tiktakam and the Varunadi Kashayam. So these are two Kashayam, they have all the same contents, but then the question arises how we will use it. So Gugul Tiktakam Kashayam and Varunadi both contains Bhallatakam. But in the Atyagni, that is when the patient's digestive fire is good, we go for Gugul Tiktakam. When it is Mandagni, the patient's digestive fire is not very good and is constipated, we go for Varunadi Kashaya. So this is how we differentiate each and every Kashaya. Similarly, you will find Dhanvantram and the Vidaryadi Kashaya. All content same, but how to use it. Most practitioners, find it difficult. Each and every content is same. So it has been clearly mentioned in the text. If you will go to the text, you will find that the Dhanvantram Kashaya, it is used Adhonabi, that is below the umbilicus. Vidaryadi, over the umbilicus. Very simple. So likewise in Ashtavargam. For Ashtavargam, it is mentioned Anilapaha. That means Vata Prakop, Vata misalignments throughout the body. Say in case of stroke, Vata Kapha disorders, you will go for Ashtavargam Kashayam. So these are the Kashayam, and we need to, certainly understand the formulations and the ingredients inside it, and then only we can specifically select a particular Kashaya. Now what this helps is, it helps us to reduce the medicines load on the patient. Nobody wants to eat a lot of medicines, right? So when we know the basic fundamentals behind each and every drug, so the medicine selection will be less and patient will be, very happy in taking one or two medicines, and then you can go further with the treatment. So likewise, we have the different Rasa, Vedva, Chintamani, Ras, Raj, Ekangi. So these are basic Ayurvedic medicines for the spine wellness.
That's a lot of medicines. Dr. Tewari, I think I want to tell our viewers, no need to memorize everything. We are going to bring Dr. Tewari again for an online class where Dr. Tewari will go through each and everything with a lot of detail.
Yes, so, I told it because some of our viewers, the scholars from various Ayurvedic college are associated with us. So just a brief to them it was.
Sure. Absolutely. So let's talk about Panchakarma therapy, how it's useful. I think all of us know what Panchakarma is now. So how does it help heal the spine, spine health, for instance, particularly?
When we talk about Panchakarma therapies, the first comes the Basti. Basti is very important for Vata suppression. The misalignments or the aggravation or the suppression of the Vata, we use Basti. It is, importing the medical decoction through anal route and directly supplying it to the large intestine. From there, it absorbs and goes to the spine and other joints. So this is one very major, the Panchakarma therapy that we use for the Vata disorders. Along with it, it is the Lepnam. So again, when we come to the Lepnam, it is selective. For Vata, you will select Nagaradi Lep. For Pitta, you will select Jatamyadi Lep. And for, Kapha, you will select the Aragvadadi Lep. So it is very clear in the text. And similarly, in, cervical spondylitis, as you can see in the screen, on the neck, we make a reservoir with, the wheat flour, and then we put the oil, and the oil has to be selected. So likewise we do. The other is same manner for the lumbar region. We do the Kati Vasti along with the simple plain Vasti that we are going through. Here also the selection of oil has to be very precise. The next is the Nasya. Nasya helps in, moreover tackling the radiating pain and cervical myelopathies that we come across. It is the insertion of oil through nostrils, and it goes directly into our cervical spine, and from there it goes to the other affected area. The next is Abhyangam. So this is a very common procedure. Abhyangam is just not a simple spine massage that we go through, but it is a very specific spinal massage where we calculate each and every vertebrae, their misalignments, and we measure the length of the muscle around the paraspinal muscles, and then we have we need a different session of spine manipulation. So massage of the spine is just a different topic. It needs at least 1 hour to talk about it. But in simple words, it's not a plain massage. We deal with each and every disc and considering the spinal muscles around it.
Okay, and then moving on to some of the other Panchakarma therapies.
Yeah. Next is the Swedana. Swedana, we select the Ruksha Swedan. Ruksh, it is dry fermentation of heat, which is for the Kapha, and Stigna is to tackle the Vata. So like I said earlier, in cervical spondylitis, we have to cut down the Kapha first. So we will select the Ruksha Swedan. It can be a Churna Pindu Swed or Jambiri Pindu Swed that are mentioned in the text, and we use it in day-to-day practice. And in the Snigdha Swedan, that is with oil. So that we use mostly in the lower back pain and all. Dhara is just pouring the oils and the Kashaya, various medical decoctions into the body. Agni Karma is my specialization, and I use Agni Karma in sciatica, low back pain, cervical spondylitis, various the kyphosis and such type of disorders. But the time of using Agni Karma again has to be very specific. It is used mostly and basically at a time when you are not getting results from the medicines and all the therapies you are involving, and you are stuck at a point. From there, that is the right target area to hit with Agni Karma. Similarly, Shirodhara is we all know it is for the mind relaxation, and since the brain is the first connection to the spine, so we need to relax the muscles. And Shirodhara here, I would like to say that when we take an MRI of the spine, say for cervical spine, so always go for, MRI cervical spine, screen brain, and sagittal view of whole spine. You never know, there might be a possible infarct coming, and it is creating the simple cervical spondylitis, symptoms, and you might miss a big diagnosis. Similarly, in case of the lumbar spine, always write MRI, LS spine, screen hip joint, screen sacroiliac joint. So here you can, just by taking two things into consideration, you can get through the big disorders like sacroiliitis and avian. So the next is the Marma therapy. Marma therapy is purely a self-healing mechanism. In the second pic, you can see I'm doing the Marma therapy on the Karpur Mar for the cervical spondylitis. Marma therapy is all about, increasing the metabolic energy, the healing energy inside the body by stimulating different points. So 107 points, Marma 7 points are mentioned in the text. So we manipulate them and bring out the, the best possible the treatment modality that we have.
Okay. So that was a very good overview of the Panchakarma, different Panchakarma therapies that are used for spine wellness. And what would you recommend post-treatment procedures?
So now this is the most important part. This is something you need to really focus on as a practitioner and as a patient as well. So when we have completed the whole 3 to 6 weeks of treatment, Then comes the posture correction. So we advise the patient to sit and stand in a good posture so that he or she, takes the benefit of our therapies for the maximum longer duration of time possible. It is usually done by the Bandhan Karma in Ayurveda, which we facilitate nowadays by kinesiology taping. We use a kinesiology tape and fix all the muscle around the spine, and whatever we have done in the past 3, 4, 5 weeks with the patient, we try to stabilize it so that it does not regain the original distorted shape and keeps the new redefined shape for a longer duration of time. Mulligan therapy is another very good, you can correct each and every disc by disc you can manipulate, and it really brings the best positive factors in patient and helps them to regain their the normal shape very quickly. So these are something points which we give especially in written, and ask the patient to follow for around 3 months, just to keep a proper posture and to maintain a proper gait throughout their usual day-to-day work.
And what exactly is Mulligan therapy? Just in a very simple layman's language.
Yeah. Mulligan therapy is a just new latest technique. Here we take a single disc by disc manipulation. It is basically spine manipulation. So we manipulate from the wrong position of spine to the correct position. So the best part of this therapy is you can take select the distorted disc, the misaligned disc, and you can treat accordingly. So that's the best part. And also it helps you to touch other muscles, and then you can advise optimal exercise. Optimal means the specific exercise therapy for the weakened muscle. Like in sciatica, we treat the lower limb muscles, so we can just manipulate each and every muscle, find the weakness, and then we advise the patient specific exercises. Instead of looking at the YouTube and doing all the exercise, we select 3 or 4 exercises, optimal exercises for the patient, and advise him or her to do that so that she can get the maximum result.
Okay, that's very helpful. Yeah. And then rehabilitation, I think, is very important. You want to talk a little bit about that?
Yeah. So rehabilitation is almost the same that we were talking in the previous topic. It is the optimal exercises that we keep doing, make the patients to do after each and every Panchakarma or the therapy session. We keep a 15-minute optimal exercise therapy by analyzing the weakened muscles, and it is moreover important for the muscle correction and the spine alignment. So this is basically muscle training and involves the muscle strength.
So let's talk about some of the modern techniques that you have been using. I know you've been doing a lot of research as well, and in this. So let's talk a little bit about that.
So the modern techniques, as you can see in the right screen, towards the right, I am using a Mulligan belt. This is to fix the this patient was having a severe hip misalignment due to the disc protrusion. We did all the Panchakarma therapies along with the medicines, and then this is rehabilitation going on. We are just training fixing his hip joint to a proper place again. And just side to that, you can see I am using the fire cupping with the glass, and this is when there is a special knot or soft tissue misalignment we find in a particular area. So we release it by fire cupping. Very good method for instant pain relief. Another right at the top, you can see I have used the cupping therapy. It is also mentioned in Ayurveda. Just earlier they were using the rhino horn, which is not available nowadays. So we use the cups, vacuum cupping, oil cupping, ice cupping, and fire cupping. You can see below that in the white shirt, you can analyze a person. He is doing the optimal exercises therapy for his thoracic spine at our clinic. So this is one more technique that we use in rehabilitation, and it is most modern technique, because just doing all the exercises won't benefit you. You need to select the muscles and you need to target the area that is really to be treated. On the left, up and down, you can see the kinesiology taping. The below, it is for the cervical spondylitis. Sometimes the patient has to go to work and he cannot come for the Panchakarma therapy, and also we do the kinesiology taping. This he can carry for 4 to 5 days on his body. It is a movable tape. Patient can do all his work, and this tape will be there for 4 to 5 days, and it will keep the neck aligned in a proper position. And above it, you can see we have fixed the sway back posture. It is a rare finding, most commonly found in athletes. You must have seen the patient bending the back. It is like a C-shaped back. So this we have fixed it with the kinesiology tape. So this is all about the new modern techniques that we involve along with the ancient Ayurvedic methods in our center.
So this is excellent, Dr. Tewari. I want to open it up for questions and answers now.
Sure.
If someone has any questions. I also want to add that we will be bringing Dr. Tewari for online classes. If you are interested, please send us an email, care@nourishtalk.com, because we will be bringing his classes that would be for professionals. Let's see if there are any questions. We'll take the questions now, live. Okay, I see someone. Well, someone is saying thanks for a wonderful knowledge. So I think you said so many medicines, so people.
Yeah, maybe.
Any questions we can answer now, but like I said, all the details, we will be bringing him back. It would be an online webinar that professionals can join, and we will let everyone know ahead of time. Well, they need more knowledge. That's what someone is saying. So that's what we are saying, that we will be bringing Dr. Tewari, and it would be a webinar. Anything else before I sign off? So before I sign off, Dr. Tewari, if you would like to summarize in 1 minute what you would say to our viewers.
Yeah, see, now today we have talked about the spine, and I think I would like to thank Amita ji for establishing Nourish Doc, which has been helping humanity, has been the major issue past the 1 month of COVID. So she is doing a great work, and everybody around the globe, I wish you the best of health, and anything you feel like I can do to you, help you in any way you feel free to ask anytime. My mail ID and numbers are always in the Nourish Doc, so please feel free to ask. And this is a wonderful platform, and I can only just request, if anybody you want some Panchakarma treatment or education, online education, so I'll be really happy to help with the the Nourish Doc platform.
Thank you so much. Thank you so much. We are just trying to educate our users on the efficacy of natural medicines, and we bring it through science, research, and success case studies. Every week you can see our webinars. Please give us the feedback. Like we mentioned earlier, Dr. Tewari would be back. He would be starting some online classes only for the professional Ayurveda students, acupuncture students. We know cupping is used for acupuncture as well, or any other professionals, chiropractors. You're welcome to join. We will be sending you emails. And I thank all of you for joining us today. Please give us the feedback. I am Amita, signing off now. Thank you so much.